Tonight, local doctors and nurses are telling us they need more supplies and they need it now. Specifically, they're quickly running out of N95 masks.
St. David's Healthcare confirmed today one of its physicians tested positive for coronavirus. The hospital did not say how the doctor got the virus. They did say it was not the result of a breach of protocol. But as KXAN's Eugene Cho found out, healthcare workers across Central Texas are getting extremely worried about not having enough supplies to do their jobs safely.
Dr. Kelly Gillette had to ask the community.
Some of these were dropped off at my house.
Because her office didn't have any N95 masks.
We definitely are better off than we were this morning.
And Dr. Gillette isn't the only one searching.
We are going to be out of those this week.
In Dr. Robin McCarty's office, they're getting creative with homemade masks.
Using pipe cleaners for the nose piece and baby diaper, cloth diaper to cover here, and having strings. It's not an N95, but it's better than nothing.
These doctors told us smaller practices are considered low priority, so these respiratory protective devices are basically back ordered indefinitely. But even for places like Austin Regional Clinic,
we know that our masks are in short supply, and we know that we're having trouble getting those.
Doctors and nurses tell me the concern is not knowing exactly what's going to happen tomorrow, a week from now, even a month from now. They say they don't want to be in a situation where they've run out of protective gear and there's a sudden surge in the number of patients. They say healthcare workers need these masks so they can safely conduct flu or strep tests and see patients.
Once our staff members start to get sick, we will be able to see fewer and fewer patients, so we're doing our best to keep them safe.
Austin Regional Clinic says as it waits for the N95 supply to increase.
We are currently ramping up video visits, telephone visits.
Doctors also say do not stockpile N95s if you're healthy, and
everyone who has extra masks that they can part with, please donate that.
Eugene Cho, KXAN News.
The depleting supply of protective gear isn't the only challenge healthcare workers are facing. Eugene also spoke with the Texas Nurses Association. They read us some comments they've heard from nurses across the state.
I work at a hospital in El Paso, and the information changes every day regarding protection, how to use the necessary equipment. There's no actual plan when asked. Everybody says a different thing.
And the association says there needs to be clear, accurate communication from hospitals to nurses and doctors. They say in situations like this, you can never over-communicate. We looked into why those N95 respirator masks in particular are so coveted right now. Testing is a big part of it. The government has approved and evaluated those masks for tough jobs. That's not the case for surgical masks. Surgical masks do protect the wearer, but they're only fluid resistant. There are also openings along the edges, which means that the wearer can still inhale airborne particles. The respirator masks, those are those N95 masks, they fit snugly and can block almost all small particles in the air. Mask maker 3M has said it's increasing production of respirator masks. They've hired more workers and added assembly line robots to try to meet the global demand.
We immediately ramped up production in this facility. We have capacity to do that, and we've done that immediately. Really from more of a standard 5-day week to more of a 7-day week, with additional equipment as well that we've been able to bring in and turn on.
Just yesterday, the Defense Department said they were offering up to 5 million N95 respirator masks along with other gear. The Defense Secretary also offered up 2,000 ventilators. The DoD is offering up its labs as well.
Those supplies are crucial as researchers learn more about how the virus spreads. A study from the New England Journal of Medicine found the coronavirus can survive in air particles for several hours. They say the duration depends on factors like heat and humidity and whether there's fog or dust. They also warn the virus can stay in the air for hours during medical procedures where gas is used. That prompted the World Health Organization to urge healthcare workers to take more precautions. Researchers also tested how long the virus lasts on different surfaces. They found it can last up to 3 days on plastic and stainless steel.
Tonight, Governor Greg Abbott